Hey future nurses, welcome back to Scrub and Spoon. How are you all doing? If you are new here, welcome. I am Nurse Funke and thanks for joining today. Okay, so today's Nclex review is meningitis. And now, this topic has been seen repeatedly in recent times, confirmed by nursing students who took their Nclex recently. So pay attention throughout the review, and please don't forget to check out my website for Master Method Study Guide. Okay, and this review is good for the RN and the PN students. Please don't forget to subscribe, don't forget to like. You're gonna enjoy the video. Watch till the end. Okay, now let's go right into it. First question: which statement best defines meningitis? A. Inflammation of the brain tissue. B. Inflammation of the meninges surrounding the brain and spinal cord. C. Infection of the peripheral nerves. And D. Degeneration of neurons in the brain. Please select your answer. And guys, the right answer is B. Inflammation of the meninges surrounding the brain and the spinal cord. And that is meningitis. Okay, now let me break it down better for you guys. Meningitis is the inflammation of the meninges. And what is meninges, right? Meninges are the protective membranes or layers of the brain and spinal cord. So that is simple definition of meningitis. Okay, as the video goes by, I'm going to talk about the pathophysiology, but let's go through the wrong choices. It says inflammation of the brain tissue. Now, this is describing encephalitis and not meningitis. Now, encephalitis actually affects the brain itself, while meningitis affects the meninges, the protective membrane, the protective covering of the brain and the spinal cord. Do you see the difference? Okay, so that makes it wrong. And C says B is our right answer, right? And C say infection of peripheral nerves. Now, what is this telling you? When you hear peripheral nerves, what is this telling you? Neuropathy. Okay, you should know that. Seeing peripheral nerves, that is neuropathy and not meningitis. We are talking about which one describes meningitis. Okay, and if you care to know that meningitis affects the central nervous system and not the peripheral nerves, so that makes it wrong. Okay, now D says degeneration of neurons in the brain. Now, this describes neurodegenerative diseases like Alzheimer's disease, like Parkinson, and not meningitis. Okay, so meningitis is acute inflammation and not progressive degeneration. Does that make sense? Okay, so that also makes it wrong. So our right answer remains B. Now let's move on. Now, next question: which pathophysiologic process occurs in bacterial meningitis? And this is select all that apply, and we treat select all that apply as true or false, so we'll go through it together. But let me read the options to you guys. A is pathogen cross the blood-brain barrier. B, inflammation of the meninges. C, increased intracranial pressure, bracket ICP, due to edema. And D, decreased cerebral perfusion. Now, remember I told you guys that I will break the pathophysiology down as we go further into review, and now here we are. So let's break the simply. This is asking you the pathophysiology of bacterial meningitis, okay? Because there can be viral meningitis, fungal. Now, let me break it down before we select our right answer, so you understand it when we are selecting our right answer. The pathophysiology of bacterial meningitis or meningitis is when infectious organism or agents, now it can be either bacteria, it can be virus, enters through the bloodstream. There are other routes it can bacteria or virus can enter, but it can enter through the bloodstream or even through direct trauma or injury to the head, right? Stay with me. Now, when this bacteria or virus enters through the bloodstream, it travels to the central nervous system and the meninges and invades. It causes inflammation, and that can cause or lead to increased intracranial pressure, right? Actually, once it enters through the bloodstream, it then travels to the central nervous system and cross the blood-brain barrier to get to the meninges. And the bacteria will invade the meninges, cause inflammation, edema. It can cause increased intracranial pressure. Okay, that's about the pathophysiology of meningitis. Now let's go through this. Now it says pathogen crosses the blood-brain barrier. Absolutely, I just told you, when the virus or the bacteria, the organism that is actually that will cause the infection, but it can be bacteria, it can be virus. Once they enter through the bloodstream or through other routes, crosses the blood-brain barrier and invades the meninges. Okay, so A is true, right? Now B says inflammation of the meninges. Absolutely. Once the bacteria reach the meninges, the body mounts an immune response, and that is when you see inflammation, and that can cause edema and irritation of the meninges. Okay, and the irritation of the meninges is what causes the classic hallmark signs and symptoms of meningitis, such as stiff neck, photophobia, headache, because of the irritation of the meninges. Okay, so B is also true. Now C, increased intracranial pressure, ICP, due to edema. Absolutely. Remember, inflammation can cause swelling, which will lead to increased intracranial pressure. Increased ICP can cause headache, nausea and vomiting, altered mental status, confusion, and in severe cases, herniation, which we do not want. We don't want to get there. Okay, so C is also true. And D says decreased cerebral perfusion. Absolutely, because increased ICP can compress the blood vessels, reducing blood flow to the brain, and this can lead to ischemia, which will be lack of blood flow to the brain tissue. Okay, it can also cause seizure or brain damage. So we do not want that to happen. D, decreased cerebral perfusion. We do not want decreased cerebral perfusion. Okay, so our right hand side is actually everything: A, B, C, D. Now let's move on. Which are classic signs of meningitis in adults? Because you can see meningitis in infants too, and this is also select all that apply. Okay, A says fever, A, fever, B, nuchal rigidity, which is stiff neck, C, photophobia, D, bradycardia, and E, seizure. Now, since it's select all that apply, we treat it as true or false. Now, all they're asking us for signs and symptoms you will see in meningitis. Now, let's go through it together. A, fever. Absolutely, you will see fever, because infection triggers immune response, which causes fever. So you will see fever. Okay, and this is one of the most common early signs of meningitis. Okay, now B, nuchal rigidity, all mark of meningitis. You will see that, and this is because inflammation of the meninges irritates the spinal nerves, and this causes stiff neck. Nclex body, classic hallmark of meningitis. Remember that on your exam. Okay, let's move on. C, photophobia. This is sensitivity to lights, and inflamed meninges also irritate the cranial nerves, and this will lead or cause light sensitivity. Also, photophobia can be accompanied with headache or pain, discomfort. Okay, now that is true. Now D says bradycardia. Usually you will see tachycardia in meningitis and not bradycardia. You will see tachycardia due to fever and systemic infection. You will see tachycardia. Okay, and last one says seizures. Now, absolutely, the inflammation, edema, irritation of the central nervous system can actually trigger seizures. So these are signs and symptoms of meningitis. Other signs and symptoms not listed here includes nausea and vomiting, headache. You would also see positive Brudzinski sign and positive Kennan sign. Go watch my video. I explained this in details, how to test for Brudzinski sign, the Kennan sign. Go watch. I made a detailed video about meningitis, so you will benefit from that video, and then come to listen to the review, to do this review. You will benefit from it, so go watch that video on my YouTube channel. Okay, so guys, let's move on. Next question says a 3-month-old infant is brought in with bulging fontanelle, high-pitched cry, and poor feeding. Which is true? A, these are normal infant behaviors. B, these signs suggest meningitis. C, fever is always present in infants. And D, nuchal rigidity is reliable in infants. Now, let's go through it together. They're just asking you, now when you see all these signs in infants, what does it suggest to you? And the right answer is B, these signs suggest meningitis. Now, let's go through it together. I've listed to you the signs and symptoms you will see of meningitis. You will see in adults, in older children, but this is infants, because it is hard or sometimes impossible to see stiff neck in infants, because you can't. They are babies. They will not be able to tell you they are feeling pain on their neck. So you cannot use those hallmark signs and symptoms of meningitis you see in adults to determine meningitis in infants. Okay, so infant specific signs of meningitis includes bulging fontanelle, and this is caused because of increased ICP. Okay, you will see high-pitched cry, signs of discomfort, of pain. You can also see poor feeding due to irritability or lethargy. So these are classic signs for meningitis in infants. Okay, so B is correct. Now let's go through the wrong choices. A says these are normal infant behaviors. Now this is abnormal. If you see this in babies or infants, this is totally abnormal. They are not normal behaviors. Okay, now look at it: bulging fontanelle, high pitch cry, and poor feeding. How can you say that is normal? That is abnormal. Okay, so that is very wrong, right? Now, C says fever is always present in infants. Now, let me tell you something. You may not see fever in infants and they may still have meningitis. So watch out for other signs and symptoms you will see of meningitis. You should take note in infants, okay? So fever may not always be present, okay? Now, and this says nuchal rigidity is reliable in infants. I just said that it is very hard to observe for nuchal rigidity or stiff neck in infants. So stiff neck is not a reliable indicator in infants for signs and symptoms of meningitis. So that makes it wrong, okay? Now let's move on. Which CSF, cerebrospinal fluid, that's what the meaning of CSF, findings suggest bacterial meningitis, okay? Now, A, cloudy appearance. B, increased white blood cell neutrophils. C, increased protein. And D, decreased glucose. E, normal opening pressure. Now, let's discuss this. Now, CSF, cerebrospinal fluid, is obtained through lumbar puncture to diagnose meningitis. Okay, so the CSF is obtained to know what type of meningitis it is, if it's viral meningitis, if it's bacterial meningitis. Now, this question is asking about bacterial meningitis, but I'll talk about both viral and bacterial meningitis. Okay, so once the CSF is obtained, they analyze the content of that CSF. Now, if it is bacterial meningitis, this is selected and apply. I'm going to give you the rundown before we go through the choices as true or false. Okay. Now, if it is bacterial meningitis, the CSF will be cloudy, and this is because bacterial infections increases white blood cell and protein, and this will make the CSF to be cloudy or turbid. Okay, so you already know that. And also, if it's bacterial meningitis, the glucose content in the CSF will be decreased because bacteria feeds on the glucose. So there will be decreased glucose, okay? There will be increased white blood cells, especially the neutrophils, okay? And also, the protein will be increased because inflammation causes the leakage of protein into the CSF. So the protein level in the CSF will be increased. And when there is high protein level in CSF, hallmark of bacterial meningitis. And lastly, if it is bacterial meningitis, you will see positive gram stain. So these are, once the CSF is obtained and they analyze, they find out all of this, then it is determined to be bacterial meningitis. Now let's go through viral meningitis. If they obtain the CSF through lumbar puncture and the CSF is clear or slightly cloudy, it can be viral meningitis, okay? Because bacterial meningitis will be cloudy, right? Now, the glucose content or level in the CSF will be normal because remember I told you bacteria feeds on glucose. That is why in bacterial meningitis the glucose will be low. But in viral, this is virus. In viral meningitis, the glucose is normal. You may see slight increase in protein and white blood cells in viral meningitis. Remember, in bacteria, it is increased white blood cells and protein because of leakage. Protein because of leakage of protein into the CSF. But in viral, there may be slight increase of white blood cells and protein. And finally, you see a negative stain gram in viral meningitis. So once they analyze it and they see all of these that I mentioned, that will indicate viral meningitis. Okay. And if it's if there is no meningitis, the CSF will be totally clear. All right. Now let's select our right answer. A is A, cloudy appearance. Absolutely true. I said that in my explanation. And B, say B, increased white blood cell. Check. Yes, I mentioned that there will be increased white blood cell. Right. C, protein. Because of leakage of protein into the CSF, yes, there will be increased protein. And did I miss something? And D, decreased glucose. Absolutely, because in bacterial meningitis, the bacteria consume glucose, so there will be decreased glucose. So, and E, last one, E, normal opening pressure. False. Bacterial meningitis usually or often increases intracranial pressure. So opening pressure is elevated during lumbar puncture. So this is false. So the only false here is E. So all our right answers are A, B, C, D, all true. Okay. Now let's move on. Which diagnostic tests are commonly performed to confirm meningitis? A, lumbar puncture. B, blood culture. C, MRI/CT scan. D, chest X-ray. And E, electrocardiogram. This is also select all that apply. Okay, so we treat it as true or false. They are asking us diagnostic test for meningitis. Now the first one is lumbar puncture. If you've been following me, I've mentioned that lumbar puncture is done to obtain CSF, right? So that is true, right? And I have also explained the what the CSF will look like if it's bacterial or viral meningitis. So A is actually true. Okay, now B says blood culture. Blood culture is also done to see if there is bacteria in the bloodstream, because that can cause infection, even sepsis. Okay, 2, blood culture is done to identify the exact type of bacteria. It could be meningococcal, it could be pneumococcal. Okay, so blood culture is done to know the exact type of bacteria. Okay, blood culture is also done to figure out which type of antibiotics will work for the bacteria. So B is also true. Now C, MRI/CT scan, correct. This is also correct. Now if there are signs of increased ICP, imaging can be done. MRI/CT scan can be done before lumbar puncture. Remember, lumbar puncture is contraindicated if there is increased intracranial pressure, increased ICP. If there are signs that there is increased ICP, lumbar puncture is prohibited. Okay, so MRI/CT scan also help to rule out mass lesions that could make LP dangerous, lumbar puncture dangerous. Okay, now D, chest X-ray. This is incorrect because chest X-ray is not used to diagnose meningitis. Chest X-ray may be ordered for pneumonia. Okay, because pneumonia can be a source of infection that can travel to the meninges, but chest X-ray is not done to diagnose meningitis. Okay, that is wrong. And E, electrocardiogram. This is incorrect. It's false. ECG does not diagnose meningitis at all. Okay, so that is wrong. All right, so our true answers are A, B, C. So D, E, wrong. Now let's move on. When performing a lumbar puncture, which precautions are important? Select all that apply again. A, check for signs of increased intracranial pressure, ICP, before LP, before lumbar puncture. Now, B, use sterile technique. C, place patient flat for 24 hours after LP. And D, obtain CSF for analysis. E, administer antibiotics before drawing CSF. Let's go through it together. Now, we're still talking about, so this is asking when you want to perform the lumbar puncture, which precautions, what are the things you need to do? Now, let's go through it together. Now, it says check for signs of increased intracranial pressure. I've told you before that when there are signs of increased ICP, it is contraindication for LP. When there are signs of increased ICP, no LP, do not do lumbar puncture for the patient, okay? Because if you perform LP, lumbar puncture in patients that have signs of increased intracranial pressure, ICP, that can lead or cause brain herniation, which is life-threatening. Brain herniation is a life-threatening condition where brain tissue is squeezed and displaced due to high pressure in the skull. You know what herniation is? It's like the brain tissue bulging out of the skull because of increased ICP. Okay, so that is why we don't want to do lumbar puncture. Okay, so this precaution is important to check for, like I said, check for signs of increase ICP before LP. This is true. Now, another precaution, B, use sterile technique. Absolutely. Sterility is essential to prevent introducing infection to the central nervous system. So sterile technique is needed during LP, lumbar puncture, such as putting on your gloves, your mask, sterile drapes, and sterile LP kit, sterile lumbar puncture kit. Okay, so this is actually true. Now C, place patient flat for 24 hours after LP. False. Routine practice does not require straight flat positioning for 24 hours. So that is wrong. Some clinicians may ask the patient to lie flat for briefly, but not for 24 hours. That is excessive, okay? So that is wrong. Now, D, obtain CSF for analysis. Absolutely. Why are we taking CSF through lumbar puncture? We are obtaining the CSF to analyze it so that we can diagnose what type of meningitis it is. Is it bacterial? Is it viral? Okay, so D is right, it's true. And E, administer antibiotics before drawing CSF. Now, antibiotics should be given after CSF is obtained. You know why? If you should give antibiotics first, that may cause false negative culture. What do I mean? You've given them antibiotics before obtaining CSF. The antibiotic might start working and start killing the bacteria or start reducing the number of bacteria, and it will not give you the right. And then by the time draw or you obtain the CSF, the bacteria might be either like subsided, reduced, dead if you've given antibiotics before drawing CSF. So best practice is to draw CSF before antibiotics, because antibiotics, when you give them, start working, it may reduce the bacteria. It will, in short, it will affect the result, the analysis of the CSF. Okay, but in severe, now real life, in severe situation whereby the symptoms the patient is exhibiting or experiencing is very severe, there's something called broad spectrum antibiotics can be given as soon as possible if it is in a severe situation or severe condition where the signs and symptoms the patients are experiencing is very severe. But after you've given the antibiotics, CSF should be obtained as soon as possible, so that the antibiotics given will not kill the bacteria, will not affect the results or the content of the CSF. Okay, so our right answer is A, B, D. C is wrong, C is false, and E is false. Okay, now let's move on. Which nursing interventions are appropriate for a patient with bacterial meningitis? Select all that apply. Now, A, place on droplet precautions. B, monitor neurologic status frequently. C, encourage coughing and deep breathing. D, elevate head of the bed 30 degrees. And E, cluster care to reduce stimuli. Now, this is also select all that apply. Let's go through this together. They're asking us that which are the right interventions, the appropriate things to do for patients that are on bacterial meningitis. Okay, now A, place on droplet precautions. Absolutely, you place, once there is suspected meningitis, bacterial meningitis, you place the patient on droplet precaution within the first 24 hours, okay, while they are on antibiotic therapy. So that is true. And why are you putting them on droplet precaution? Because bacterial meningitis spread through respiratory droplets. So you are putting on your surgical mask when you are within 3 feet of this patient. Okay, and also patients wear mask if they have to leave the room or be in the hallway. Okay. B, monitor neurologic status frequently. Absolutely, yes, because meningitis can cause neuro symptoms such as headache. You can see increased ICP, seizure may happen. So yes, you have to monitor neurologic status frequently. Now, C, encourage coughing and deep breathing. Oh my God, no. You want to encourage your patient to avoid strenuous activities, any activities that will cause them to strain, because that can lead to increased intracranial pressure. So you don't want them to strain at all. So this is wrong. This is very wrong. Coughing, bending, straining can increase ICP. So we don't want them to, you do not encourage them to cough and deep breathe. Okay. Now, D, elevate head of the bed 30 degrees. Absolutely. This promotes venous drainage. Okay, that is good. It helps to reduce ICP. So that's why we're putting their head in 30 degrees, the head of the bed in 30 degrees. Okay, it also improves comfort. All right, and ensure their head is in the midline. So this is true. And E, cluster care to reduce stimuli. True, because meningitis patients are very sensitive to noise, to light. So cluster care means if you have to take the patient's temperature, you have to do their vitals, you have to reposition them, you want to clean them, try as much as possible, instead of you going back, maybe you have to do this thing 5 minutes apart, try as much as possible to provide this nursing intervention for them, or nursing care for them at once. Because you coming back and forth into the room can cause overstimulation for them. You touching them can cause overstimulation for them. Turning on the lights, talking to them will not allow the brain to rest. We need the brain to rest. So cluster care is encouraged in meningitis. Okay. So also I need you to know that overstimulation can trigger seizure. It can also trigger headache. So that's why cluster care is encouraged for them. All right, guys, let's move on. Which are risk factors for meningitis? Select all that apply. A, skull fracture. B, immunocompromised state. C, living in crowded dorms. D, daily exercise. And E, recent ear or sinus infection. Now let's go through it together. Since it's selected apply, we treat it as true or false. Okay. A, skull fracture. Absolutely. Skull fracture, especially basilar skull fracture, can create pathway for the virus or the bacteria to get to the meninges. Remember I told you that there are different routes the bacteria or the virus can travel to the meninges to invade it. I mentioned bloodstream. I said direct. I also mentioned direct impact. This is an example of direct impact to the head, skull fracture. Okay, so this is true. Now B, immunocompromised state. Absolutely. Let me explain it. Patients that are immunocompromised, like patients that have cancer, they're on chemo, patients with HIV/AIDS are immunocompromised. They have immunosuppression. So they are at risk of getting infection quickly. So they are at risk of getting meningitis quickly. Okay, so that is true. Now, living in crowded dorms, absolutely. Crowded space, crowded environment, like school dorm, like military barracks, like shelter, are people living in these crowded environments. Meningitis can easily spread in crowded environments. Okay, and the daily exercise, actually exercise boosts immunity and reduce risk, so there is no link to meningitis with exercise. D, recent ear or sinus infection. This is an example of nearby infection. Now, if you have ear infection or sinus infection, this organism that cause the infection, either bacteria, different types of bacterial virus, they can travel. Now they can cross the blood-brain barrier, get to the meningitis, get to the meninges, invade it, and cause inflammation and all of those symptoms you see. So this is actually true. Okay, so our right answers are A, B, C, E. Only D is wrong. Okay, now let's move on. Now, which nursing care measures help prevent complications of increased ICP in meningitis? Select all that apply. We will do it. A, keep head in neutral alignment. B, avoid coughing, straining, or sneezing. C, cluster care and reduce stimuli. D, place head of the bed HOB flat. And E, administer stool softeners. Now let's go through it together. So we're just asking for measures to prevent increased ICP. Let's go through it together. Keep head in neutral alignment. This is true because we want normal blood flow in and out of the brain. Okay, so if the head is flexed or rotated, it impairs venous drainage, and this can cause increased ICP. So neutral alignment means head in the midline. The head is in the midline. Okay, that is true. Now, B, avoid coughing, straining, or sneezing. I have explained that because that will increase ICP. So we don't want them to do any straining, anything that will cause any straining activities, because that will increase the ICP. So that is true. Cluster care and reduce stimuli, have explained this. Do as much care as possible you can do for them. Instead of coming back and forth, we want the brain to rest, we want them to relax, we don't want them to be overstimulated. So if you can take the vital sign, if you can reposition them, if you whatever you want to do, that can be done within the same time, you can do it to reduce stimuli. So this is true. I'm not explaining too much because I've explained about them before. Now, place HOB, head of the bed, flat. This is incorrect, false, because flat HOB, head of the bed, will increase intracranial pressure. So this is wrong because venous blood cannot drain from the brain. So we don't want to keep the head flat, okay? Best position to reduce ICP is 30 degrees. Head of the bed at 30 degrees and head in the midline. Okay, that is wrong. And E, administer stool softener. Stool softeners like Dorcocet will help to soften the bowel and prevent straining, because when they go to the washroom and they're straining, that will cause, we don't want any activity that will make them strain. That can increase ICP. So our right answers are A, B, C, E. Only D is wrong. Okay, let's move on. Which preventive measures help reduce the risk of meningitis? Select all that apply. Guys, you know something, what I love about select all that apply is if you can get select all that apply right for that topic, you are good. So I know that select all that apply can be challenging, but I'm glad we are doing it. So your nursing school exam is not going to be anything for you. You're going to ace it. So let's go. And this is second to the last question, so we are almost done. Now, which preventive measures help reduce the risk of meningitis? Select all that apply. Okay, now, so A, vaccination. So bracket HIV, pneumococcal, meningococcal vaccines, right? B, good hand hygiene. C, avoid sharing drinks or utensils. D, daily antibiotic prophylaxis for everyone. And E, cover mouth when coughing. Okay, so let's go through it together. Now, no brainer, taking your vaccines, for infants, taking their HIV vaccines will help to protect against meningitis. Okay, so A, taking your HIV, pneumococcal and meningococcal vaccines will actually protect against meningitis. Okay, because these vaccines protect against most common bacterial meningitis, so you will be protected. B, good hand hygiene. We know that to break the chain of infection, proper hand hygiene. You sing happy birthday, wash the hand with soap for 20 seconds. Okay, this will help to break most chain of infections. Okay, now C, avoid sharing drinks and utensils. This is actually true because some type of bacteria that cause meningitis, like meningococcal bacteria, is spread through saliva or respiratory secretions. So when you share cups, straw, lipstick, or water bottles with someone that is carrying meningococcal bacteria, even though if they are asymptomatic, if you should now take their cup to drink, you may be infected. So that is why this is actually true. So avoid sharing drinks or utensils is true because one of the bacteria that cause meningitis, meningococcal bacteria, is spread through saliva or respiratory secretion, and you may not know that the other person have that bacteria and you get infected with it. So that is true. Now, daily antibiotic prophylaxis for everyone. This is wrong. You know why? Antibiotic prophylaxis, let me explain it to you, is like a preventive measure. You are taking antibiotic daily. It's like a patient taking antibiotic daily to prevent them from getting a disease, right? Even before the signs and symptoms start showing. But look at it, it says for everyone, not for everyone. You can give antibiotic prophylaxis for people that are exposed to patients or someone that is already diagnosed with meningitis, such as their family member. So you can give them antibiotic prophylaxis because if the family member is exposed to them, they live together, it's important to give them so that they will not also be infected with the bacteria, the organism, okay? So not for everyone, only for people that are exposed to a patient or anyone that is diagnosed with meningitis, okay? And you know another thing, if you give antibiotic prophylaxis to everyone, you know what will happen? The bacteria will become resistant to the antibiotics because they've been taking it too much. Now the antibiotics can no longer kill the bacteria, can no longer work again for the bacteria to get rid of the bacteria. So antibiotic prophylaxis is not used for everyone. It's used for patients that you feel like they've been exposed to this infection. They may get this infection. So to prevent them from having it before the symptoms start occurring, you can give them antibiotic prophylaxis. Now guys, the very last one. I'm so glad you stayed till the very end. Now let's do the last one. Now, which clinical signs in meningitis require immediate attention? Select all that apply. A, severe headache and stiff neck. B, fever and vomiting. C, mild fatigue. D, seizures. Now they're asking us which clinical signs in meningitis require immediate attention. Let's go through it together since we select all that apply. Now, A says severe headache and stiff neck. Hallmark of meningitis, nuchal rigidity. Okay, it requires immediate attention. Okay, because severe headache plus stiff neck, nuchal rigidity is suggesting meningeal irritation, and this can lead to increased ICP. So it requires immediate intervention. See, the severe headache alone and the stiff neck should let you know that, okay, these are hallmarks, signs and symptoms of meningitis, and attention should be paid to it, okay? Now, fever and vomiting. Absolutely. High fever can signify infection and inflammation, okay? And vomiting in meningitis often indicates increased ICP or systemic illness. So this combination is suggesting that the meningitis is progressing and must be treated as soon as possible to prevent deterioration, okay? So that is also true. Now, mild fatigue. Now, fatigue can be signs of many other things. A patient can be fatigued or can experience fatigue due to other conditions. So this is not an emergency. This does not require immediate attention or any intervention except it progresses with other symptoms. Then we can be worried about mild fatigue, the fatigue, okay? D, seizure, requires immediate attention. This is neurological emergency. I need you to also know that bacterial meningitis is life-threatening, is emergency, okay? It needs to be treated as soon as possible, okay? Now, seizure, when you see seizure in meningitis, it shows that the infection is affecting the brain tissue or the ICP is dangerously high. If this is not attended to immediately, this can lead to permanent brain damage, respiratory complication or compromise, or even death. So it requires immediate attention, immediate intervention, okay? You need to intervene to protect the airway, to control seizure with benzodiazepines if it's ordered for the patient, okay? You also want to know the measures to reduce ICP. Encourage them not to strain, head in the midline, head of the bed 30 degrees, and IV antibiotics ASAP, as soon as possible. Okay guys, I hope you've enjoyed this review. Please don't forget to subscribe, to like, and send this video to any nursing student that will benefit from this. Okay, bye.